My name is Nahlah Ayed. I'm the host of CBC's Ideas, and I'm really, really delighted to be with you here this evening. I'd like to start by acknowledging that UBC is on the traditional, ancestral, and unceded lands of the Musqueam people. And since we're also live streaming, I thought I'd also give a really warm welcome to all of those who are connecting with us tonight from all over. And I'd like to invite you as well to reflect upon the Indigenous lands that you are on today. Welcome to every one of you to the final event of the 2022 Phil Lind Initiative Speaker Series. As many of you know, of course, the focus has been on the future of media, exploring the transformational change in today's media landscape, and more importantly, where do we go from here? Tonight, I'm pleased to welcome Ed Yong to UBC. Ed has spent the day, of course, meeting with some graduate students, about 10 of them, in the affiliated Lind Initiative course at the School of Public Policy and Global Affairs. And the course, as many of you know, is taught by the wonderful Catherine Gretzinger, who is former CBC radio host and now associate professor of teaching at UBC's School of Journalism, Writing and Media, and by Dr. Justin Alger, the Lind academic director. We're here tonight because of the generosity of UBC alumnus Phil Lind. He has made not only this event possible, but all of the other previous events that all of you have been enjoying in the last weeks and months and year after year. He has given students, staff, and faculty, and the community around the university and beyond the opportunity to bring esteemed and respected and well-known guests as Ed Yong to UBC. Now tonight, I'm here as representing CBC Ideas, and we're really pleased to be working with the Lind Initiative and very much hoping that this could be just one among many that we'll do in the future. We're also hoping to bring this event to many more audiences, perhaps hundreds of thousands of people, on a future episode of CBC Ideas, the show that I host and which we like to describe as Radio for the Mind. To you, our audience, please feel free to tweet along quietly with the event using the hashtag Lind22. And after Ed is done speaking, we're of course going to take questions from the audience, and you do that through Slido. Just visit slido.com with the code hashtag LindSlido. Now I'd like to introduce our keynote speaker for tonight, Ed Yong. Ed Yong is a staff writer at The Atlantic and named the most important and impactful journalist of 2020 by the Poynter Institute. He was awarded the 2021 Pulitzer Prize for explanatory reporting for his coverage of the coronavirus pandemic. He anticipated the course of the virus, the complex challenges that the US and many other countries faced, and he chronicled the poor government response in the US. For his exemplary coverage of the pandemic, Ed has also won, ready for this, the George Polk Award for Science Reporting, the Victor Cohen Prize for Medical Science Reporting, the Neil and Susan Sheehan Award for Investigative Journalism. This is career goals for you guys still on your way to becoming journalists. The John P. McGovern Award from the American Medical Writers Association, and the AAAS Calvo Science Journalism Award for in-depth reporting. Beyond his pandemic coverage, Ed Yong is one of the world's foremost science journalists. He is the best-selling author of I Contain Multitudes, The Microbes Within Us, a groundbreaking, informative, and entertaining examination of the relationship between animals and microbes. His second book, An Immense World, it's called, will take a comprehensive look at the amazing sensory worlds of animals. In addition to The Atlantic, his work has appeared in the National Geographic, The New Yorker, Wired, Nature, New Scientist, Scientific American, among others that we don't have time to list. A very warm welcome to Ed Yong.
Hello. Thanks for coming today. I wanted to start by asking for your preemptive forgiveness if there's any part of this talk where I sound like maybe I think I'm in America right now. I am aware that I'm not, but I have been chronicling the pandemic and especially the US response to it for the last 9,562 years, and it's very much on my on my mind, but I'm hoping the lessons from that experience will be more broadly applicable in other settings too. So what I want to do here today is to talk about how I've approached pandemic journalism, how I've thought about my own responsibilities over the last 2 years, and perhaps more importantly, why I continue to do this work now. And I want to start by talking about these two pieces. The one on the left was written in 2018 about whether the US was ready for the next pandemic. Spoilers, no. And the one on the right was written in 2020 about why things were so bad, how a country that was reportedly the most prepared in the world could have fared so badly against a novel pathogen. The one on the left talked about what I now think of as standard pandemic preparedness, to talk about chronic underfunding of public health. It talked about hospitals stretched by a just-in-time economy. It talked about the difficulties of creating a vaccine against a novel pathogen. The one in 2020 was considerably broader. It talks about things like overstuffed prisons and understaffed nursing homes. It talks about the shredding of social safety nets that forced poor essential workers to risk their lives for their livelihoods. Talked about decades of systemic racism that meant that Black, Latino, and Indigenous Americans were especially vulnerable to the virus, both physiologically and socially. Talked about social media platforms that spread misinformation far and fast. And it talked about how the dismissal of post-viral chronic illnesses like ME meant that when many COVID-19 patients presented with the symptoms of what we now think of as long COVID, doctors had little to offer them except for more dismissal. The first piece treated the pandemics very much as a science story in the way that I had been trained to do. And the second one treated it as what I think it actually is, an Omni Crisis, an event that upends every aspect of society and that absolutely forces us to be cognizant of the sciences, but that also forces us to grapple with the interplay between science and everything else. Because this is a crisis that affects everything else. Its influence has been profound, its reach vast, and its stakes extreme. And the problem with covering a crisis like this is that many of our standard journalistic instincts, our modes of operation, our incentives, work against us. For example, our field gravitates towards fragmentation. Our natural tendency is to chip smaller pieces of big stories and show them to people one at a time. Or when it comes to science, show them one paper at a time. And that often and usually works. It's the bedrock of most of my career as a science writer. But in an Omni Crisis, it just leads to confusion. Readers end up with a smattering of disconnected pieces, unaware of how to fit them together to make decisions in their daily lives or to understand how to view the crisis as a cohesive problem, how to see the bigger picture. At the start of the pandemic in early 2020, I tried to write pieces that would give people that bigger picture. I wrote pieces that answered questions that I thought everyone was asking before they even realized that they were asking them. Questions like, how will the pandemic end? Why is all of this so confusing? Why do we seem stuck in this same rut? Why is our experience of the pandemic so different from place to place and from community to community? I wanted people to come away from these pieces feeling like they understood something, like they could zoom out and see everything that was going on around them, disparate and fragmented though it may be, and that they could feel a sense of stability, a platform from which they could then make decisions from their own lives and to understand what was happening to them and what was about to happen. This isn't just about telling people what is happening, which is, I think, a thing that we are very good at in our profession. This is about helping them to make sense of what is happening, which is a considerably different task and that requires different skills and disciplines. Sense-making is a skill unto itself. It's different than just reporting. It's something that my wife works in and thinks about a lot, and this is how she thinks about it. That there's just been this incredible explosion of knowledge, of science, of expertise, and that we need to knit it together. And not only do we need to do that, but we need to do that at pace, quickly, because the stakes are so high. So how do we do that? Well, I think one thing we need to do is to understand the breadth of the problem. There there has been a tendency throughout the pandemic for journalists to treat doctors as fonts of all wisdom. And this isn't to downplay the vast expertise that medical professionals have, but I think to treat them as experts on everything about the pandemic is problematic. Even within medicine, doctors are just one kind of healthcare worker, and others have experiences and expertise that are germane to the task too. Medicine is also very different to public health. Medicine is a field that cares for sick individuals. Public health is a field that prevents sickness in entire communities and populations. Two different disciplines with very different trainings, ways of thinking, and principles that underlie how they approach a problem. When it comes to public health, there are also people who work in specific areas like the law or policy. So much of our pandemic coverage has focused on these two particular things. Is this policy feasible? Is it legal? And yet, people who work in these areas are often underutilized as sources. The social sciences matter tremendously. I have gained so much from talking to Scientists come in many different shapes. There's virologists, of course, but virologists can't be expected to say everything there is to say about a pandemic, despite the fact that at its core is a virus. The social sciences are also super important. I've gained a lot from talking to disability scholars, anthropologists, ethicists, historians. They have provided so much grounding in everything there is to know about the pandemic and understanding how to frame, how to view today's decisions in the light of everything that has come before. In a recent piece on grief, I talked to obituary writers, funeral home directors, people who are grieving loved ones themselves, grief counselors. And finally, patients are really, really important, especially in all the writing I've done on long COVID. Long haulers themselves are by far and away the most knowledgeable people on their condition. And their expertise is profound and has radically shaped how I've thought about that problem at points when even academic researchers had no idea about long COVID as an entity. My point in all of this is that expertise, as it currently exists, is very, very deep, but also narrow. And for our work to also be deep but broad, we need to talk to a wide range of people with expertise in a lot of different areas, rather than treating any one person as a source unto themselves. I don't think it's that useful, for example, to just interview, say, Anthony Fauci and just write down what he says as a sort of oracle on all things pandemic. I think you need to talk to a wide range of different people. There's also been a problem of people relying on the same sources again and again and again. The same names keep on cropping up in pieces again and again. I think this is problematic because it deprives you of this broad range of expertise, but it's also problematic because it makes you incredibly vulnerable if any one of those people are full of shit. My strategy for pandemic reporting has been this, that in every piece that I write, at least half of the sources must be people who I've never spoken to before. So my pool of sources keeps on expanding with every story, not just in disciplines, but just in terms of the individuals. I must have talked to like hundreds and hundreds of different people, and I never regret trying to find new ones. There's always interesting new expertise to tap into. Having a wide range of sources not only gives you a diverse range of expertise, but also helps you to find something that I think is a little undervalued in pandemic reporting, which is the right frame of analysis, the right ways of thinking about the problem, full stop. For example, I've repeatedly talked about how the pandemic is fundamentally a collective problem for the very basic and very obvious reason that infectious diseases spread. At every stage of the pandemic, collective threat has outweighed the individual threat. Consider the Omicron surge. The new variant may be slightly less severe than some of its predecessors. So spike for spike, if you get infected, you're probably a bit better off with Omicron than with Delta. But it spreads incredibly quickly. And so a fast-spreading variant with a slightly reduced severity is still going to create a huge volume of a huge absolute number of very sick people enough to overwhelm a healthcare system, which is exactly what we saw when Omicron spread through the US. So we cannot think of this problem solely in terms of individuals, in terms of individual risk, in terms of a bunch of individuals acting even simultaneously. Instead of asking, what's my risk, you have to ask, what's my contribution to everyone else's risk? And it shouldn't even be down to individual people asking that question. To deal with crises of this kind, we need governments to put in policies that protect the health of entire populations. But we forget that. And the US in particular has an incredible penchant towards individualism. From its founding, it has cultivated a national mythos around the capacity of individuals to pull themselves up by their bootstraps, ostensibly on their own merits. And many pundits, even now, only think about the pandemic in the context of individual risk analysis. Sorry for laser flashing you over there, I pressed the wrong button. Where the thinking is, am I safe? And if the answer is yes, then we must all be safe. People have been mocked for thinking collectively. Young or vaccinated people are told that they are irrational for being worried about taking precautions when their personal risk is low. Never mind whether those people might be thinking about their chances of infecting all the vulnerable people around them. This kind of myopia afflicts even the highest levels of government. When the CDC made its first guideline flip-flop saying that people who were vaccinated no longer needed to mask indoors, Rochelle Walensky, the director of the CDC, repeatedly used the rhetoric of individual responsibility, saying your health is in your hands. Is it though? Because I'm pretty sure that infectious diseases spread. So at the minimum, my health is profoundly influenced by the hands or the noses or mouths of other people around me. But also, and more importantly, your circumstances constrain your choices. People's social conditions affect the kinds of actions that they can take to protect themselves. Essential workers who held hourly wage jobs with no paid sick leave have a much harder time of isolating themselves for fear of losing their livelihoods. They have a much harder time of finding the time to make a vaccine appointment, to go for vaccinations, to go for testing. Other people have made this point better than me. Aparna Nair, a historian, notes that this view of individual responsibility, framing one's health as a matter of personal choice, is antithetical to the practice of public health. Rhea Boyd, a public health advocate and pediatrician, talks about how the responsibility of public health is to protect everyone, the population, and specifically the most vulnerable first, a thing that has been repeatedly forgotten and ignored throughout the pandemic. We have spent endless amounts of time talking about the problem of misinformation, which is often defined like this, and that's fine. But we often think of misinformation in terms of what is essentially trivia, like, does hydroxychloroquine work, yes or no? But to me, the more significant problem is misinformation as incorrect or misleading frames of analysis, entire ways of thinking that lead us astray in the context of a crisis of this magnitude. To me, encouraging people to think about the pandemic solely through the lens of individualism and individual risk is as much misinformation as claims about ivermectin or some such. One of the factors, I think, that prevents us from learning the right frame of analysis is that we are perpetually trapped in the present. We, in journalism especially, are vulnerable to this because we are a profession of the now. We care about the news. But to fully understand what is happening to us right now, we also need to understand the history of the areas that we cover. So in 1849, after investigating a typhus outbreak, this guy, Rudolf Virchow, who then became known as the father of pathology, realized that epidemics were intimately tied to social conditions like poverty, overcrowding, squalor, hazardous working conditions. These kinds of social problems profoundly influenced which communities got sick and which stayed healthy. And so, as Virchow famously said, medicine is a social science. This line of thinking fell away during the early 20th century because of germ theory. When scientists realized that many long-standing illnesses were the work of microscopic organisms, that created a very different vision of how to tackle disease. Pioneers of germ theory like Robert Koch put forward this vision that was steeped in ideas of war and imperialism and technocracy, in which we finally had easy villains that could be subjugated through the judicious application of research and technology. All those kinds of social problems that Verka talked about suddenly felt irrelevant. People thought that it was more apolitical and objective to think about how disease solely as battles between pathogens and hosts. It was also easier. You didn't have to deal with intractable social problems. You could just look down at the microscope at a bug and find a way of annihilating it. This biomedical paradigm deeply influenced how the Western world thought about disease for over a century. And it's why today we still think of preparedness in terms of things like drugs and vaccines, and not in terms of things like social safety nets and paid sick leave and trust. What we needed in the pandemic was this, the Swiss cheese model, layered defenses, things like masks, vaccines, ventilation, social solutions, working together. But what instead we got was this, vaccines almost to the exclusion of everything else, or sometimes pitted against other measures like masks. Now, don't get me wrong, vaccination is incredible, and the fact that we have multiple effective vaccines against a disease that no one knew about 2 and a bit years ago is truly extraordinary. But what we forget is that a vaccine is just a product, and tech-obsessed nation that we are, we assumed that once we got the product, we would solve the problem. But a vaccine is useless without vaccination, and vaccination is a system. It relies on all that social stuff. It relies on access to the medical system, the time and flexibility to make an appointment. It crucially relies on trust, and society trusting each other, medical providers, governments. If you don't have those things, you will fail, even with the right product. The US was instrumental in the development of vaccines, but is still now 66th in the world in terms of vaccination and 63rd in terms of boosting. More people have died in the US since vaccines came out than before. Just a fact that should shock and appall us and shake us out of this way of thinking about preparedness. I don't think our leaders understand this. When Francis Collins, a really lovely guy, retired from the NIH, he talked about how we underestimated vaccine hesitancy. No one I knew who had been studying vaccine hesitancy underestimated its power in a pandemic. Fauci and others keep on talking about how we're going to make vaccines within 100 days of the discovery of a new pathogen as a sign of future preparedness. It baffles me that you could look at the events of the last year and a half and think that just making the thing sooner would fix all the problems we've had, especially since the rapid pace of vaccine development is a cause for vaccine hesitancy in many groups. And part of the problem here, why we cannot solely rely on the products of the biomedical enterprise, is that epidemics and tech solutions flow in opposite directions. Epidemics flow downwards into society's cracks, taking out the most vulnerable groups first. Biomedical interventions rise upwards into its penthouses. New cures, vaccines, and diagnostics first go to people with power, wealth, education, and connections, who then move on. That's what we've seen over the last year from my profession in the media, from many voices in medicine and public health. And this is why many health inequalities so stubbornly persist across the decades. Bruce Link and Joe Phelan talked about this in 1995 in their theory of fundamental causes, the idea that the social conditions underlying diseases last over time because no one fixes them. And so even though the pathogen of the day changes and even though medical progress is ostensibly made, the same problems occur again and again because no one addresses them. Part of the problem, I think, is that we think about science in a very, very simplistic way. Like this, that there are questions, and then science happens, and then we get answers. And this allows us to say unironic phrases like follow the science as if there is a clear linear path to follow, when in fact, science works like this. It is a messy, stumbling, erratic path to slightly reduced uncertainty. It doesn't often provide clear answers, and crucially, the answers that it does provide need to be passed through the social values and cultures that we all exist within. Daniel Goldberg, a public health historian and ethicist, said this really well to me. Science is not a product, it's a practice, which means it's a thing we do, which means it's social, which means it's value-laden and political. The end. Think about what I said earlier about the biomedical paradigm, about the rise of the counterpoint between medicine as a social science and the rise of germ theory. Germ theory is incontestably correct. It is a super useful thing to know about and a way of understanding the world. But it also inadvertently led to a slightly blinkered way of thinking because it was interpreted through the cultural norms of the time. And my fear is that because of all of these things, a weird understanding of what science is, a tendency to ignore the marginalized, a failure to learn from our past, a sort of fealty towards individualism, we keep on making the same mistakes again and again, as Phelan and Link suggested. Everything I wrote about in these two pieces were predictable and preventable. All the flaws, like the cracks in US society that the pandemic so easily exploited and exacerbated, were already being talked about. It's just that we had come to tolerate it. And people have acted as if the pandemic was unpredictable, even as it was happening. And it wasn't. We were warned about all these issues. The problem is that we accepted the foundational rot. The problem is that normal led to this. Normal is a state that so many people have desired to rush back towards throughout the last few years. But what normal actually is a set of baseline conditions that meant that a novel pathogen could easily roundhouse kick the most powerful country on earth in the face. The catch is that, so we will carry on making these same mistakes again and again unless we interrupt this cycle. Well, the problem is, to interrupt this cycle, we need to understand what I've talked about, the history leading up to it, the big picture. These folks, Elizabeth Fee and Theodore Brown, around 20 years ago, lamented that in terms of public health, the US had failed to sustain progress in any coherent manner. For exactly the cyclical pattern of panic and neglect. If we do not wish to repeat past mistakes, they said, we should learn lessons from the past to guide us in the future. Good luck with that. The good news, if you are fans of Greek mythology, is that pandemics allow you to be both Sisyphus and Cassandra at the same time. I've written a lot about the panic and neglect cycle, about the fact that when crises happen, people panic because they're underprepared. And then attention and money and investments flow into dealing with the problem. The crisis is over, all of those things go away, and we're left in the same state of unpreparedness that we were stuck in before. The next slide looks deeply messed up, but I'm going to go with it. All right. What this should read is panic across the screen, and this is what we're doing now. We're not even waiting for the panic bit to be over before we cascade through multiple cycles of neglect. This panic neglect cycle is often framed as a problem for the future, one that leaves us unprepared for the next variant or the next virus. But the problem is we are also neglecting the recent past, the fact that the problems of the pandemic have mounted and accumulated over the last 2 years. Again, journalism, because of our laser focus on the present, is very vulnerable to this problem. But this roller coaster of an epidemiological curve is not the story. And this, where we are with it right now, is not the story. This is the story, the cumulative toll of the pandemic as it has accrued over all this time. 2 years of trauma and grief weighing down upon marginalized groups among healthcare workers. We often forget this. We as a field, we as a society, we focus on the now. I've been trying to address this in my own writing. I wrote this piece about healthcare workers burning out because of the pandemic in actually a moment last year that was right in the trough of hospitalizations, when they were at their lowest between the Delta and Omicron peaks. This piece is about how buffeted by the traumas of those surges, many healthcare workers often quit afterwards, getting through on camaraderie and adrenaline, but then burning out once they get a chance to breathe and exhale. I've written a lot about long haulers who are still struggling with symptoms of their COVID infections, months, sometimes years after they first encountered the virus. I've written about the physical and the economic consequences of that long-term disability, especially at a time when so many people have moved on past the pandemic. I've written about immunocompromised people, many of whom are still exquisitely vulnerable to the virus, some of whom are still vulnerable despite being vaccinated and boosted. Many of them are forcibly told to reintegrate with a society that seems to care very little for the residual risks that they still bear. And most recently, I think just last week, what is time anymore, I wrote this piece about people who are grieving, people who are stuck in unending cycles of grief because they couldn't say goodbye to their loved ones, because they didn't have mourning rituals, because they've been faced by omnipresent triggers of the pandemic or insensitive questions, things like, were they vaccinated, coming before, I'm sorry for your loss. Whenever I write one of these pieces, a lot of people will email me saying that this is the first time they've seen something in the press that fully reflects their experiences. Now, many other journalists are doing work of this kind, but clearly not enough because so many people still aren't feeling seen and heard. I think we are complicit in the same kind of forgetting and neglect that I've talked about, that dooms us to endless cycles of the same problems. I said earlier that epidemics flow downward and medical interventions flow upwards. Our profession is in the up bit. We are disproportionately white, abled, affluent, and privileged. We, on average, do not include the very people who need us the most in our pieces or sometimes in our sources. We're among the earliest to get vaccinated, and many people then decided that it was safe for everyone. I wrote this piece about how the US could have normalized to so much mass death, why in January and February of 2022, the fourth and fifth deadliest months of the pandemic to date, the media narrative seemed very chipper, why people were talking about returning to normal and the imminent arrival of endemicity and all the rest. And partly the answer is that it is much easier to ignore the plight of the marginalized if you're not one of them. Early in 2020, my colleague Adam Server wrote this piece about how many people in the US looked past the crisis when they realized who was disproportionately dying. He got a lot of crap for this, but his claim was backed up by this study which came out just a few months ago, showing that knowledge of inequity not only fails to move the country to act, but actively suppresses action. This is both a moral travesty and a self-destructive one, because those lingering inequalities are going to ignite the pandemics of the future, the epidemics of the future. As Mary Bassett once said very pithily, our inequality makes me vulnerable. And by by forgetting the thing that's supposed to be at the center of public health, we make all of ourselves vulnerable in the future. I think about us a bit like this. So these are army ants. Army ants lay down pheromone trails as they walk, and successive ants follow the trails of their predecessors. But if those ants happen to loop around in a circle and the trails connect on themselves, they often get stuck like this, walking in endless circles, imprisoned by their own unhelpful instincts, unable to see the bigger picture until they die of exhaustion. This is called the death spiral, and it is, to me, a perfect metaphor for where many of us are with the pandemic and how to think about it. So, what now? Why do this work if things look bleak? I've asked myself this question a lot over the years. It is frankly dispiriting work to do, seeing the same mistakes being made again and again, even in the middle of a crisis. Being Cassandra and Sisyphus at the same time is no fun. Also, talking to sources who are suffering and then seeing others in my own industry act like everything is over is also hard. This has been infuriating, it has been devastating to my own mental health, and it can feel futile. But it isn't, and I'm going to explain why I still think that and why I think this work is still worth doing. Firstly, we still have the ability to change people's minds. Our work can reach an audience and change the way they think about different problems. The grieving piece that I showed you that published most recently, I have had emails from people saying that it showed them a different way of interacting with people who are grieving losses from COVID, taught them better ways of extending grace to those who are suffering. But also, this isn't just how an audience works. We often think of it like this. Piece goes out to its readers, full stop. Who are these readers? Surely they're limited. Why do the piece? But those people then talk to other people. And those second-order effects are really powerful. I've had people writing in saying that they've used my work as tools for talking to conservative and skeptical family members about the pandemic, as ways of negotiating with their employers, as ways of explaining to their friends why they are worried or grieving or anxious. Those kinds of second-order connections, those network effects, you probably will never hear about them unless people are kind enough to tell you in a message, but they exist and they are powerful. If the pandemic should have taught us anything, it's that we are social creatures, and our work exists in that social environment too. And even if none of that happens, even if you just reach one person, even if that person is already on your wavelength, even if you're just preaching to the converted, that matters. In a crisis like this, with so much uncertainty, so much instability, it matters a ton to give people validation, strength, and stability, to help them feel more secure and surer in their own decisions. I've said before that the infectious nature of a virus means that a tiny bad decision can cause exponential harm. But the flip of that is that a tiny kind decision can do exponential good. So you should not underestimate the power of just reaching one person at a time. But I also think that we can do more. The pieces that have mattered the most to me are the ones that bear witness to suffering. This is one of the most profound and important things that we can do as journalists and as people. These pieces, to me, are a kind of rebuke to the societal amnesia that I talked about, this tendency to focus entirely on the present and ignore the pandemic's cumulative toll. For the people in these pieces, they are meant to say, I see you. And for everyone else, they are meant to say, remember. These are the pieces that I am proudest of, the ones that will stay with me once all the awards and all the rest fade into memory. I'm going to show you some replies to some of the pieces I've done recently, some grieving piece and the immunocompromised one. I show you these not to blow my own trumpet, but to say this is what our work can do. This is the impact you can have on people, the kind of grace that you can extend to someone. We can give people the gift of recognition and validation. For those who are lost and alone, we can say, you aren't. For those who feel abandoned by their communities, who feel like their lives don't matter because they're implicitly or explicitly told that that's the case, we get to say through our work, actually, they do. And we are one of the only professions that have that power, that have that ability, and that can use it at scale, a scale commensurate with the nature of the pandemic itself. In June 2020, I wrote this piece about long COVID, about long haulers, people suffering through months of symptoms. This was at a time when none of the researchers I talked to knew about this problem, and when only patients themselves were talking about it. I wrote this piece because many long haulers were writing op-eds about their own problems. Mara Gay, Fiona Lowenstein, Paul Garner, Felicity Callard, many others were representing themselves. And this story helped to prompt a wave of further coverage that took long COVID into the mainstream. This is the work that I am proudest of, the legacy of my pandemic reporting that I hold closest to my heart. I do think that this work can matter, even if we still keep on making the wrong policy choices. There is a way of thinking that I hold dear to my heart and have done for a long time, and especially since the pandemic. It's called the Stockdale Paradox. It's named after a man named Vice Admiral James Stockdale, who was a prisoner of war in Vietnam. And when he was freed, he was asked, how did you survive all those years in confinement? And he said, many of the people around him thought they would be out by Christmas. Christmas came, they weren't out. They thought they were out by Easter. Easter came, they weren't out, and they broke. He survived because he held two almost contradictory ideas in his head at the same time. The need for absolute unwavering faith that you can prevail with also the discipline to confront the brutal facts, whatever they are. This is how I've tried to think about the pandemic over the last 2+ years. It's the type of thing that I try to instill in my work, telling the truth about how bad things are when they are bad, but also noting there is always the possibility for a better future. Things might look bleak, more pandemics are imminent, we are much less prepared than we are in some important ways, than we were in some important ways, but we cannot afford the luxury of nihilism in our work or in ourselves. One truism of the pandemic is that it's always possible, we always still have time to make the right decisions. And as I said, part of the true value of journalism is not just in saying what is happening, but helping us to make sense of it. And helping us to make sense of it involves also understanding what is possible. Thank you very much.
Thank you so much, Ed Yong, for a wonderful address.
Thank you, thank you.
This is the part of the conversation, the awkward part, where I ask, would you prefer me to wear a mask?
I think it would be good.
Okay.
I think it would be good for the room.
All right.
Let's do it.
This is just part of life now.
All right, appreciate it.
Okay. Just a reminder, if you have a question for Ed, obviously we're going to take those from you. So just go to slido.com with the code #LynSlido. So that's #LynSlido, and we'll get to those questions shortly. But I have quite a few questions for you myself.
Please.
So we'll start with those. I reread your 2018 piece entitled When the Next Plague Hits. Mm-hmm. You wrote that to mark the centennial of the 1918 Spanish flu. I found it eerily prescient, just like everybody else. And you really predicted not only what happened in the pandemic, but our response to it. We could spend hours discussing just how prescient you were. But I'm curious as to this. What is it about you as a journalist, the skills that you had as a journalist that allowed you and made it possible for you to predict what was coming?
So I think that being a science journalist, you learn to process a lot of information very quickly, short period of time, to try and synthesize across a large amount of disparate information, to try and run towards uncertainty and nuance where possible. I think some of those qualities came out in that piece. I do not have training in this. I don't have an infectious disease or a public health background, but I found who I thought was the right people to talk to. I talked to them, and I tried to weave those threads together, right, like Spider-Man and the fairies, like trying to unite those disparate threads of information. What I think is really interesting, though, about that piece is that there are definitely parts of it that are prescient, but I look back and I see the holes. I see the things that are missing from it that have become clearer over the pandemic.
Like what?
There is absolutely no mention of inequalities whatsoever. And the fact that the burden of a pandemic would disproportionately fall upon certain sectors of society, socially disadvantaged people, people of color, elderly or disabled people, all of the ideas that have threaded throughout my pandemic coverage since. There is no mention of the role of misinformation or of societal trust as a concept that is pivotal to a pandemic response. So this is what I meant, that a lot of what is in that 2018 piece, I stand by it all, but it feels narrow to me looking back at it. And I think there is a broader way of looking at this kind of problem that I feel I've tapped into over the last 2 years. And I slightly worry that isn't taking place more commonly. I wrote a piece about how I think we're already barreling towards the next pandemic, and wrote that late last year. And it points out that the pandemic preparedness plan that the Office of Science and Technology Policy created for the US is kind of like the old model. It feels like it could have been written in 2018. It's got a long section with lots of detailed bullet points about vaccine creation, and it's got one bullet point about inequities, which is basically like deal with them. So yeah, I think I'm grateful that people find that piece prescient, and I think it was a very good starting place, but it absolutely feels to me like a starting place.
In your own defense, if I may, I mean,
Please go.
The contrast between how prepared or unprepared the U.S. is compared to a country in Africa kind of did highlight a bit of the story of the difference in how the response would be and the inequality. I'm just wondering, though, when were you satisfied with your discovery or with your treatment of the issue of inequality in this pandemic? Because it really did come to the fore at one point. When was that?
I don't even think I'm massively satisfied with it now, but I think it really came to the fore in quite early on. I want to say like April or May of 2020. I think it became abundantly clear quite quickly that the pandemic was going to have a disproportionate toll on people of color especially, but many different groups.
Is there a story or an image that comes to mind?
So I wrote that piece about the Patchwork Pandemic, and that began as an idea about the fact that the virus isn't hitting everywhere at the same time. And that's part of the problem with the response, because some communities haven't seen it and think that a lot of fuss is being made for nothing, and others, like New York, were being absolutely pummeled. But what I did in the piece was try to say, that patchwork has always existed. That patchwork exists because of patchworks that have gone back to the country's very founding. And so, we create an unequal society. Those inequalities are then expanded and promulgated by every new pathogen and left to fester and rot for the next one. I think that was the moment, but I don't remember. I don't remember if there was like a specific thing that.
No problem. I want to discuss with you what you describe as the impossibility of defining science writing. It's something you address in your writing and you address tonight. You say that it's a question of what is science writing is a question that we shouldn't be able to answer. Why not?
Because science is so deeply intertwined with everything else that we do and everything else we are. And so I think the kind of science writing that I feel is most relevant and germane to our current challenges must include science and be of science, but also tap into everything else. The pandemic pieces I've written have, I hope, a strong scientific core, but also draw deeply from the social sciences, from history, from ethics, from all the other disciplines that I talked about. And I think that makes it difficult to categorize these things. I had the great honor of guest editing the Best American Science and Nature anthology last year. Was it this year? No, it was last year. And the pieces I chose were deliberately those that skirted that boundary, that were about science and nature, but also addressed how those things are profoundly influenced by our humanity, like what things we value, the consequences of science for all of us, the consequences for our cultural mores for the practice of science, who gets to be a part of science in the first place. It has a long hauler reflecting on their own symptoms. It has a writer talking about being a black person in outdoor spaces in the US. It has, lots of pandemic stuff, but a lot of things about other areas. It has a piece about a small town that's right next to SpaceX's operation and how that's being impacted. So yeah, I think at a moment of grand challenges of the loss of biodiversity, climate change, pandemics, we have to better appreciate the ways in which science and everything else are threaded together.
You've described tonight and in your writing this pandemic as an omnistory. That's an Omni Crisis.
Yeah.
And you asked this question, so I'd like to ask you your own question, which is, does anyone truly have the expertise to cover an Omni Crisis?
Right. Right. So I certainly don't. I feel like I have. I feel
We're
like
in trouble if you don't.
I feel like what I think I have become good at over the last 2 years is finding the right people to talk to and trying to talk to a wide range of them. So like with this grief piece, I've talked to people who are grieving themselves as experts on their own experiences and their own lives. I talked to thanatologists, is a discipline that I didn't know existed until a few weeks ago, of people who study death and loss. I talked to people who have experienced as grief counselors, obituary writers, funeral home directors, EMTs, ER doctors. I wrote a piece last year about, at a point when Trump had just got COVID and was talking about how he was sort of dominating the virus, and there's this sort of big man rhetoric. I wrote a piece about why we equate strength with the ability to fight off an infectious disease. And for that, I talked to doctors, I talked to immunologists, I talked to anthropologists, linguists, just a bunch of people who had different ideas on this different takes on this concept of strength. All the history that I talked about, the germ theory stuff, Virco, all of that comes from talking to sociologists, historians, and so on. So I think part of this job, we like elevating and finding heroes, but I think that in journalism especially, that instinct is a negative one. I am only as good as the sources who I talk to and the expertise I choose to talk to. This work is only good because it reflects the much, much deeper and broader knowledge of hundreds of individuals who I've had the privilege of chatting to over the course of the last few years. Mm-hmm. And my skill, such as it is to find them and weave their expertise together in a way that's cohesive for a reader.
Do you ever think about the parallels between the endeavor of science, the scientific method, and the journalistic endeavor? Is that something is there an analogy there that's useful that goes beyond that circuitous route that you say science normally follows?
I do, because if science is a messy and meandering stumble towards gradually less uncertainty, so is journalism. Right? That is all I'm trying to do, and I'm trying to do it over the course of multiple interviews. I was saying to the students I was talking to earlier, one of the things I do to try and make sense of all of this beyond my own knowledge and expertise is to try and iterate across multiple interviews. So if someone tells me something, the next person I talk to, I'll probably say, this person just said blah, blah, blah. Do you agree with that? You just told me X, Y, Z. It makes me think the following. Does that ring true to you? And there's this process of trying to actually make sense of things on the fly in the middle of a conversation or across multiple conversations that I think brings us closer to that, to quote unquote the truth, an area of gradually reduced uncertainty. That it resembles the scientific process in a way that speaks true to me.
What's been really remarkable watching the coverage of this pandemic and living the pandemic is how many people have become literate in scientific terms that maybe 10 years ago we would never have been talking about in public. I wonder, given that, if indeed the average person has become more literate in science and scientific information, why has there been such a backlash, do you think, against science and the scientific method?
Right, so I think it's because some of our ways of thinking about this problem don't match the reality of it. So I've always been quite skeptical about the talk of scientific literacy because of exactly this. Often it ends up being about trivia, it's about facts. So a lot more people now know what mRNA is, or know what, like, I don't know, a spike protein is, right? Right, so there's lots of things that people know much more than they did before. Like everyone in the cousin on Twitter is now an expert in epidemiology, apparently, before having moved on to Ukrainian politics. But like for a while, they were, the world's experts, or all of them. But that doesn't necessarily mean that you understand science as a process, which I think is what it actually is. I mean, even like scientists themselves, we've seen making exactly this mistake, like reducing this rich, messy human endeavor into this series of facts and statements that are easier to verify. And I also think that it is very easy to see some of the backlash that's happened as being anti-science. I think we should resist that framing, because I don't think it's helpful. I think that a lot of this, so in the science of science communication, there is a concept called the deficit model, which is essentially that you treat people as empty vessels into which you pour information and knowledge, and that is how you change people's minds. So if someone is skeptical about vaccines, you give them information about vaccines, and boom, changed hearts and minds. And of course, that is just not how people think about decisions or process information. People process information according to their own values, to the values of their communities, to the social pressures around them, to how they were raised, to what they care about. And I think if you don't understand that, if you treat them through deficit model thinking, if you think that they haven't listened to me, they haven't instantly changed their minds, so they must be anti-science. The problem lies with us, right? Not with them. Like, it means that we are not thinking about how to communicate information in an effective or empathic way.
There are many people who would argue that we are living in an anti-expertise age. Are you saying that you don't really buy that?
No, I do agree with parts of that. I think that expertise is often devalued. But, as I've said, I think there are many kinds of expertise that are important here. And sometimes I see people with scientific or medical expertise doing the same thing, like not paying attention to the expertise of others around them. I have interviewed a lot of people, and to be honest, everyone is wrong about something. Yes. And like I've many cases where people are experts in one area and then suddenly weigh in on like the problem of misinformation and do the deficit model thing. And there are people who study that. There are people who study the way misinformation occurs, the pathways through which it spreads, the reasons for people to buy into bits of misinformation or not. I actually very rarely see those people being treated as expert sources. As I said, often you get like an epidemiologist or a doctor treated as this sort of expert, right? And that is also a kind of devaluation of expertise. It's a failure to recognize the nature of modern expertise, which is deep and narrow.
In a previous interview, you said that just because people buy false information, that doesn't mean we get to abandon them.
Yeah, absolutely.
So what should we be doing?
Okay, so if we think about the vaccine issue, right? So why are people unvaccinated? The two kinds of categories of answers that people give are usually either access issues, so they can't get to a vaccine site, they don't have time to make an appointment, they don't have a reliable medical provider to encourage them to get a vaccine, right? So, and then there's also hesitancy. So I'm skeptical about it, I'm worried about side effects, I'm anti-vaccination, I don't trust the government, etc. Those two things are not easily dichotomized. Those two things overlap. Because if you buy into, even the people who are most staunchly against vaccination, you've got to ask, like, why is that? Like, which media sources are they tapping into? What does everyone else in their community say? Why does that community so resist that idea? I rarely think it's because they are anti-science. I often think it's because they have low trust in government. And I think sometimes that lack of trust is reasonable given circumstances. So there are lots of differences, there are lots of social differences and social conditions that affect people's uptake of information, what they believe, what their entire community believes. And I don't think any of that is reason to just discard them. I mean, I have had annoying people show up in my mentions as much as anyone. You know, I'm not here to like downplay the harassment or the vitriol that many people in this space have received, far from it. But I think that it is very easy to say, to this point, to this entire group of people, and dismiss them, or worse, to say that they deserve to die. I think it's appalling. You know, there is a surprisingly large number of people who feel okay saying in a public space like Twitter, unvaccinated people should be allowed to die, and yet are incensed when I block them. I mean, you know, like, I think that, I also think that casting the unvaccinated as this kind of like zombie-esque horde who we should just discard is a very, very convenient rhetorical ploy, because it takes responsibility away from the leaders and the people in positions of power who could have made decisions that protect all of us, vaccinated or otherwise, and could have put in the layered defenses that I talked about, instead of putting all their eggs on a vaccination basket that, had they thought about the misinformation problem at all, they would have realized was an unworkable solution in itself. So.
There are many questions we have to get to from the audience, so I'm only going to ask one last one. Just given the challenges that you just outlined, and given the very useful analogy that you made with the fact that epidemics flow downwards and that medical solutions rise upwards, how do you make science, good science journalism and writing, more accessible to more people? What's the piece that's missing?
Yeah, I think, so a few things to that. If you'd asked me this question about 3 years ago, I would have said storytelling, so narrative, all that good stuff, you know, tapping into the fact that we're all social animals, we're all storytelling animals. You know, everyone loves a good plot, everyone loves good characters, you can make work accessible in that way.
But that doesn't cut it anymore.
I think it's part of it. I don't discount it, but it can't be the only answer. I think that one thing I've tried to do throughout my entire career, through the books, in all the pandemic work, is actually just to make things beautiful. Like I think that even when talking about the worst possible things, even talking about things that are pessimistic and grim, if the writing sings, people will be more likely to read it. And it's almost like a gift, you know, like in exchange for you engaging with this very difficult material, I'm going to make it as pleasant of an experience as possible. I think there's something about that blending of science and, you know, poetry and art that is important. But also I think, so I talked about the work that matters most to me right now. I have found writing about the pandemic very difficult. The mental health cost is significant. If I'm at a place where I find it very hard to continue writing about the pandemic, I want to do the type of work that matters most, that has the most impact on people. And to me, that's the kind of work that reflects groups of marginalized people who don't feel seen and heard. Who feel left behind. So stories about long haulers, immunocompromised people, healthcare workers, grievers, and so on. I think that at the core of that work is empathy and compassion. I really want to know what it has been like for these groups of people to experience the pandemic, and I want to write work that reflects their experiences to them, that says, I see you. And sometimes I think that we don't think about that enough, either in journalism because we value being hard-nosed, or in science journalism because we sometimes think away from the humanity at its core. But I think it's crucial. I think it's why that particular genre of work has resonated with the people that it has. And it's something that I want to do more of.
Thank you very much. Let me go to some audience questions here. So we have one here. I mean, some of these you might have sort of touched on already, so maybe we can kind of dispatch through them fairly quickly. But one here from Adriana. How has covering the pandemic changed how you approach communicating scientific uncertainty in particular?
It's a good question. I mean, we are so steeped in uncertainty all the time and have been throughout the pandemic. You know, I think that one thing I've tried to do in my work, especially in the larger pieces, is to be very clear about showing my working. You know, I've said that I use interviews as a way of iterating my way towards gradually reduced uncertainty. And as far as possible, I try to put that in the work so that a piece is not just, here is a message. Like, we often think about a message. And I want to try and walk readers through how to think about a problem so that they get information, but they also get the right frames of analysis, which I talked about. And part of that is about showing your working. It's about sort of walking people through an idea so that why we think about something, why we think the things we think is more important to me than what we actually think. Right? The process matters. I think you can also get at uncertainty through interviews. So I interview people who are often frustrated at the fact that journalists press them for an answer. Whereas I'm rarely doing that. I'm trying to ask people what they think about something. And if they don't know, great. But I want to know, why don't you know? Like, what are the factors that contribute to your uncertainty? Can that uncertainty be reduced? If it can be reduced, over what kind of timeline can we expect that? And I think that actually makes for much more interesting stories, and stories that, so we talked about trust, right? I think if you do this, you engender more trust in people. And if you try and think things through on the page, if you try and anticipate counter-arguments and address them in the work, it creates something that's just much more solid. Otherwise, you know, people feel like you're trying to sell them something, right? And I'm not. I'm just trying to walk them through a problem.
Okay. Sort of this is challenging to do with this next question, but it follows from that. What are your thoughts on the role of Twitter in this pandemic and in the future of science journalism communication? So those are the challenges in normal communication, never mind on social media.
I will just say that I try and log off Twitter quite a lot. And whenever I do, the deactivate your account button is just always there, just above the log off button. And my God, it's tempting. I struggle to know what to say about Twitter because I find it both incredibly useful as a professional tool and also a nightmare. I don't enjoy using it, but it has been useful for finding sources. It has been useful for seeing the types of things people are talking about. That whole bit about trying to preempt the zeitgeist, the questions that people were going to ask before they were asking them. Twitter is useful for that. But, you know, I use it in some very specific ways. I use it to promote my own stories so that I get them to a wider range of people as possible. I use it to try and uplift the work of other people who have smaller platforms or who I think are doing amazing work. And I use it as an information gathering tool. But I don't use it as a platform for discourse. My specific rules on Twitter are: do not punch down, do not engage, do not get into arguments with strangers on Twitter, and absolutely do not be a pundit. So I do not tweet or opine about something that I have not reported on. I only try and talk about things that I actually have literally just written a piece about.
Thank you for that. A third question here from an anonymous audience member. How do you maintain the narrative when an increasing percentage of the population grows more and more frustrated with COVID restrictions?
In some ways, it's a simple thing because the core of the work is to try and tell the truth. So even though more and more people may be frustrated, I think our responsibilities remain the same. You know, even if I have to write these pieces and become the most unpopular person on the internet, the pieces remain the same. You know, I'm not trying to curry favor. I don't want to be popular. I don't like none of that. But also, there's an angle here that I think is undercovered. So there's a really interesting paper that came out late last year showing that if you ask a representative sample of people in the UK and the US about their choice between two potential futures, a back to normal one that prioritized economic recovery and a progressive one that prioritized addressing inequalities as a response to the pandemic, more people in both places preferred the progressive future. But crucially, more people in both places thought that most people preferred back to normal and therefore thought that it was more likely. This is called pluralistic ignorance, where we think that the minority view is actually the majority one and think the majority view is the minority one. We see this at play throughout the pandemic. Mask mandates have just been lifted on airline travel. A poll was released, I think, either today or yesterday, showing that the majority of people support the use of masking on public transport and think it's a good idea. And yet, one of the narratives that has been spun is that more and more people are frustrated with this, that people don't want this, it is unpopular. But I think our perception of what is popular or not is both skewed and self-perpetuating. And we self-perpetuate it, like by
we the media.
We the media self-perpetuate it. One of the things that promotes pluralistic, one of the conditions that creates pluralistic ignorance is when policy leaders and people in the media, people in positions of narrative power, push those narratives forward.
So those videos we've seen of people applauding on planes because the masks are coming off.
Right. So
is that not reflective?
But that reflects a second dynamic, which is that we pay attention to extreme voices, like we absolutely do. If you had the reverse happening, if you had a mask mandate being announced on a plane, do you think the people who put their masks on would suddenly be like in raucous applause? No, they just silently put their masks on and then like sit in their seats.
So how should we treat those voices?
I think we should recognize that they exist, but I think we should also give them due weight. And I don't think that we should suddenly say that society as a whole has moved in this direction when we actually have empirical evidence that it hasn't. And we saw this like even early on, when in the first wave of the pandemic, when first lull happened and surges and cases went down and things started opening up again, all the focus was on people who were out and about, going back to their normal lives because they were visible. Like everyone else who was still hunkering in their homes, like they weren't on the news broadcasts, because no one saw them. There's an issue of visibility, there's an issue of extreme reactions capturing our attention, and there's this issue of pluralistic ignorance.
You mentioned earlier, just as a quick follow-up, that the message that perhaps you were trying to get across is what's my, this idea of what's my contribution to everyone's risk, as opposed to what the risk is to oneself. If that message 2 years in has not sort of resonated with the majority of people, where precisely do you place the blame?
Yeah. Where do I place the blame?
I mean, is it a communication problem on the part of the scientists, or is it a science journalism problem? Is it a policy problem?
I see it coming through in a lot of different areas. I see it coming from our leaders. There has been a huge amount of individualistic rhetoric from now 2 different administrations in their own particular ways. It is strange to me to see, the leader of the top public health agency in the country talk about stuff like this. Public health voices have done this too. Medical voices, prominent people on social media and on the news have talked about this. And I think if you sort of go into this fundamental causes idea, I think this is why I keep on talking about individualism as a sort of root cause of it all, that we are trained to think in this way. Mm-hmm. So the answer to the question, I think responsibility is diffuse. It always is in the pandemic. And I think our failures are always systemic as much as they are individual. So it is, as I've said, it is very convenient for people in positions of power to treat this as if it was solely the sum of a lot of individuals acting cumulatively. Whereas in fact, there are absolutely policies and measures that could be put in place that protect the lives of entire communities. I think one of the greatest lies of the pandemic is that we messed up because a lot of individual people didn't do the right thing.
Here's a sort of a departure from all of this, but an excellent question. Are there lessons you have learned about communicating the pandemic that could be transferred to communicating the climate emergency?
Yes. We're screwed. No. No. So I keep thinking about this idea of science and society threaded together, about talking to a diverse range of experts, about listening to the history behind the problems that we're covering. A friend of mine, Alice Bell, a British writer, wrote this incredible book that's called Our Biggest Experiment, a full history of climate change, how we understand what we know now. And I think it's really important to have that background. I'm going to approach this question a little bit like sideways, but I was sort of thinking about this in the area that is closest to my heart, like the loss of biodiversity, the 6th extinction, even before starting writing about COVID. I wrote pieces about the mental health cost to coral reef researchers who are studying an environment that is disintegrating before their eyes. I wrote about the heavy responsibility of people who are looking after the last surviving members of imminently extinct species. I think there's something about sort of tapping into the humanity at play there that's important, and about sort of understanding the history at work. Yeah, I'm not sure I have a better answer to that question.
Okay.
But yeah, there is something about seeing it as not just a science problem that matters to me right now.
It's an omnistory, crisis.
It is an omnistory, absolutely.
How do you build public trust and address inequalities when half the American public have been told/taught inequalities are political and/or don't exist?
I wish I knew the answer to that question. My life would be a lot simpler. I think that the question of how do you build trust, I think, is often framed in the wrong way. That it's a little bit deficit modelly, right? Like we think that trust is a thing that we can sort of wheedle our way towards. And really the only path to earning trust is to be inherently trustworthy. That's why earlier the question about like how do I talk about insecurity, my answer about showing the working, is also partly a way of gaining trust by being deserving of it. the people who have told me that they have used my work to open conversations with people who are skeptical or conservative family members who doubted the pandemic at all. What those people have said is that the reason the pieces work is that they feel like someone is walking the reader through an idea, rather than hammering them over the head with a policy or a statement or a message. That, yes, the pieces always have, like, you know, I hope a strong moral center and like a clear statement, a clear argument to be made. But I think they also justify that argument. And of course, there are going to be people who just look at like a headline, read a few paragraphs in and go, no, and check out. Mm-hmm. But I think there is a lot of work we can do at the margins. And I think there's a lot of work that we can do to empower people who sit on the margins to act as points of contact. You know, like I said, it's not just me, like, it's not me and like a conservative pundit at the other end and me trying to change their mind with my piece. Mm-hmm. It's me giving people tools that they can use to have conversations with their family, their friends, their colleagues. We're all, you know, these nodes of information and communication. My wife wrote a piece in early 2020 about talking to people in a pandemic. And, you know, she talked about how the pandemic has sort of conscripted all of us into being science communicators. And that work is difficult, but I think that these pieces can help those who are engaged with that work to do it more effectively. Mm-hmm. It's always the kind of feedback that I value most, the people who say, like, I showed this to, like, my skeptical dad, and instead of just shutting me down, he said, that's interesting. Mm. That's a good point. Yeah. You know, I think we can make starts.
You talk about the difficulties that you find in achieving that task, and this next question is about precisely that. After reporting on a multi-year pandemic with grueling social consequences, how have you taken care of yourself and your mental health as a person and journalist?
Badly. Okay. So it has been hard. It has been difficult for all the reasons we've talked about. Making sense of this for myself while I'm going through it, the challenges of knitting so much information together, the anxiety about whether I've got it right, whether I've been fair, the immensely high stakes, and then the kinds of pieces that I said I'm gravitating towards because I feel burned out and I want to make the most impact in the least amount of time. Those pieces also take the most out of me. Like they involve, you know, talking to people who are going through a lot, holding their pain in, like being present for it. The flip side, you know, the cost of doing work that prizes empathy is you really like have to sit inside the heads of people who are going through a lot. Yeah, I feel like for people who are going through this too, all I can say is it sucks and it's hard. There's only so much, like, you're not going to meditate or yoga your way out of this, right? Like, I do have, I have 3 people who do a disproportionate amount to look after my mental health. My wife, who is not only a supportive partner, but an intellectual, an intellectual conspirator. Like her ideas and her thoughts about the pandemic, a lot of the things I've talked about, her empathy and compassion are all the bedrock of my work. My editor, who is wonderful and helps me think through these quite difficult ideas, helps to share that burden and looks after my emotional needs as well as my words, and my therapist. I found a very good therapist at the end of last year, and that has helped immensely. But yeah, I'm not sure what to say about it other than that it is difficult, and I think it's like, I know a lot of pandemic journalists who step back from it, and I think if people make that decision, all power to them. I might have to imminently, but I think it has both been the hardest thing that I've ever done, and also the most fulfilling thing that I've ever done. I think that's the right word I want. It's a privilege to be in a position to make a difference in something like this, and I think like there is something unique about our profession and our ability to impact so many people in such a fast-moving environment that I think I don't take that responsibility or that privilege lightly.
Thank you for sharing that. It's a good place to start, but we do have time for one last question, or good place to stop, but we have one more to go. How can individual journalists do better at tackling, quote unquote, foundational rot? Should we cross the line into advocacy and activism more to fight these inequalities? Oh,
that's a great question. Okay, so the first thing I'll say to that is the question is about individual journalists, right? And I have said in my pieces and tonight that our failures are as much systemic as they are individual, and so are our successes, right? Like, I couldn't do the work that I did over the last 2 years if I didn't have an environment and a workplace and an editorial team around me who gave me the space and the time and the mandate to do that. And I think people who are under daily pressures to produce breaking news coverage don't have that luxury. So partly, I think as a field, we need to think about how we can create the environments and the incentives for people to do bigger picture work, to do work that addresses that kind of foundational role. To the question about advocacy and activism, like, I do still draw a line. Like, I don't think of myself as an advocate, and I don't think of myself as an activist. I often report on groups who fit those descriptions. I think well of their work. I write about it. I draw inspiration personally and hope from it. But I do see myself as slightly distanced from it, and I have to be. You know, I know you like. Some people describe me as like a long COVID advocate. I don't see myself in that way, but I am immensely sympathetic and I care about it a lot. I think I'm in my strongest position by maintaining a bit of distance from it. Same for like grieving, for immunocompromised, like all for all the groups that I talk about. And I think one can do that. You can care a lot and still maintain a bit of distance. It does add a little bit to the mental health bit of it because it's isolating. One thing that these groups all get to draw from is a sense of community with each other. Like, a lot of long haulers have found communities of their own. A lot of grievers have found strength together. Healthcare workers absolutely done the same. But I can report on all of these communities, but I am not a part of them, and that's a little lonely. But again, I think it's part of the job. I think we have to do that.
Ed Yong, thank you so much for taking all these questions.
Thank you.
Thank you.
Thank you so much.
Thank you for doing what you do. It's so important. And a really big thank you, if you don't mind, also to the staff members who were involved in this in tonight. Becca, Lindsay, Tina, Carol, and the team of volunteers at the School of Public Policy and Global Affairs who work very hard to make this series happen. Really huge thank you to all of you. And a really big thank you to Phil Lind for making tonight possible. And of course, thanks to all of you for being here, both online and in person. And if you want to hear this discussion again, it will be on the Phil Lind website, on the UBC website, but also look for, hopefully, an episode on ideas coming very soon. Thank you very much. Thank you. Thank you.